if their incisors line up. So the midline of the upper incisors and the midline of the lower incisors, should line up. If they don't, it could mean that there's a lateralization of the mandible. It also could mean they just have bad dentition, meaning their teeth are like crooked. But usually if their teeth are crooked, you'll be able to tell, because it's not just going to be one or two teeth. It's like, their whole mouth's going to be crooked. Now actually, in the Monday lab, I was doing this demonstration on Dr. Saman, and I was looking, and it was off. And he said he has an implant in the center. So, that's kind of really cool. So anyway, that's what I'm looking for. The other thing I'm looking for is a patient when they open and close their jaw. A couple times. So I'm looking for symmetry. In that swing and stance phase, it should be like a hinge. But sometimes a patient will have a little jig-jag.
What are you looking at?
You look at the joints here?
No, I'm looking at her mouth open and closing.
Okay.
And then the other thing I'm going to do is I can either put my thumbs on the tragus here, which is right on top of the TMJ, or I can put it inside the external auditory meatus, and I can still feel the mandibles. And I can ask the patient, go ahead and open and close a couple more times. Okay. So what I'm feeling for is for the jaw to open and close. If they are in alignment, they will open symmetrically. But if there's a fixation, one will open before the other. So the one that's fixated will open up second. The other thing that you can do sometimes is you palpate the jaw, the TMJ here. It may feel to you like it's lateralized. You can also be able to tell that through the dentition, right? The lines lining up. The other thing that you can do is, this is joint play. So I'm just going to kind of hold my hands like this, put my index and my middle finger on the mandible, and then just make sure your jaw just relaxes. Just push back and forth. So this is like joint play, right? Like blotment. See if one side seems like it doesn't want to go this way or doesn't want to go that way. The side doesn't want to go, it means it's fixated, okay? There are a couple other things I'm just going to demonstrate very quickly in relationship to treatment. These will not be on the test, but just so you can understand, you can do various types of cranial things. You can use bimastoid pressure, where my thenar eminences are underneath here on her mastoid processes, and I can just squish together like this. I can do a rotation like that, or a rotation like this. This is just mobilizing the temporal bone, of which the mastoid is part of, and it also is the glenoid fossa for the mandibles where it fits. So you're just moving that. This is pretty subtle stuff, because obviously this is kind of like cranial sacral. It's pretty subtle, but it can have an effect, in relationship to the overall dynamics of that. The other thing that I can do is come down here on the mastoid, come here on the temporal bone, and then just kind of like do like this, or do like that. Yeah, so again, these are not on the test, but these are just other ways in which you can provide some dynamic effect. You can come up here and do the same thing on the temporal bones themselves, and then you can feel the sutures. And you just give a little kind of shaky, friction, and that can affect the alignment of the temporal bones as well. So those are very subtle, but they can be helpful. A couple other things that you can do for TMJ, I don't think I did this in class, but there are muscle resistance techniques like isometric exercises. And so what you can do is you can have the patient open against resistance. And so just use the heel of your palm, put them under your jaw, try to open your jaw against resistance, right? You can't open it because your hand's there. And then you can close, and there's two ways to do that. You can use your fingers on your teeth, or you can just use the web here in the chin. So open up your jaw. So you really can't because you're holding it. So that's isometric. The other thing that you can do, I think I did show this in class, is just push laterally one way, push laterally the other way. So these are just isometric, and they help with the muscles that help move the jaw. And then the last one is to put actual physical pressure on the lateral, also known as the external pterygoid muscle, which is internal. And so it's at the angle of the jaw, so you just got to go in there to where the angle is. And this is not very comfortable. A lot of times patients don't like to do it because it hurts like a mofo. But remember, the pterygoid attaches the superior compartment, or the superior head of the pterygoid attaches to the disc in the TMJ. And if that pterygoid has a lot of tension, it will put traction on that disc, and that can make it go kind of anterior. And that's where you would quite commonly can get clicks when people open up their jaws. And so now, if a person has a lateralization of their TMJ, so these are the manipulations. So in the test, I'm going to ask you just to set them up, and then just kind of, not without actually doing a thrust, but just show what direction you would go. Because I don't want anybody to get a messed up jaw. And all the joints in your body you should have respect for, but the TMJ is one you want to have special respect for because you don't want to give somebody a TMJ issue. So just be pretty careful in relationship to that. But it can be very profound if a person has a TMJ problem, but to do this, it provides sometimes pretty dramatic relief. So for a lateralization, I'm going to put my hand, so my thumb is kind of in the forehead, my other hand is on the side of the head. Then I'm going to come in with my pisiform on the mandible, and I'm just going to push laterally like that.
You're just pushing here.
Just pushing laterally. So again, for you people over here, you can see I'm holding the side of her head. Again, you want to make sure that their jaw is relaxed. Maybe the jaw just slightly open a little bit. Across, and just straight across like that. So again, I'm perpendicular to the mandible. Now, if it is hypomobile, meaning it feels like it's fixated but not lateralized, the correction, the contact with the indifferent hand is going to make the same kind of cradle hold as if you were doing cervical manipulation. So I'll do it on both sides. So this is how the hold would go. So this just looks like a cervical correction, right? Then I'm going to come in, find that mandible, put my pisiform on it, take my slack out, and then just drive through the axilla. So again, this hand, like you would be doing a cervical manipulation, rotate just so you get things stabilized, find the jaw, come in here, take your slack out, and just drive that way. This is a pretty specific and, I can't think of the right word, discrete kind of correction. This is definitely not bull in China shop. Like I said, you don't want to jack up somebody's TMJ. All right. Any questions? All right. So you can go ahead and set those up. And I do want to save some time for the endonasal